Morning, everybody. I am going to start a new series of videos called COVID Talks, where I discuss all things coronavirus, because I think that's all anybody wants to talk about anymore. And I'm going to be looking at the road, but this is the easiest method for me to just film a quick video and share some information with you. So these videos are going to be short and sweet. I'm going to focus on one subject at a time so that it's a little bit more digestible. And in today's video, I'm going to talk to you about whom to believe. Because there is so much misinformation out there, friends, that y'all are just hitting that share button. Maybe not such good information. It infuriates healthcare workers because you guys don't know what to believe. So y'all are all conflicted and you're all sharing false narratives, and it makes it really difficult for those of us in healthcare because we're just trying to uphold our arguments about what we're seeing, and y'all are battling us on it. And it's because one person or one media outlet decided to share some bad information. So I know it's tricky for y'all. So I am one of those people you've got to decide if you're going to believe as well. I am a nurse practitioner. I work for 2 different institutions here in Georgia across a couple of different campuses, but I cannot share with you publicly who I work for because I value my job. And I am not on here as a representative of those hospital entities, so I can't tell you. You're just going to have to make a choice on whether or not to believe me or not. What I can share with you is that I am an acute care nurse practitioner. I work in ICU settings, multiple ICU settings. I treat a heck of a lot of COVID ICU. I've been doing this for 3.5 years as a nurse practitioner, and before that I was a nurse, a bedside nurse in ER and critical care for like 16 years. So that's my background. That's about all I can tell you. I was trained at Emory University, if that helps at all, but this is what I'm telling you about myself and what I'm willing to share. And I'm also going to place a caveat here that these are my opinions. These are conclusions that I have come to through the practice that I've done and through the research that I've done. And I'm willing to share with you what I'm seeing and how I've conducted research so that you can do so yourself. Because all of you seem to want to do that. You know, I would say if there is a benefit to this virus, this pandemic, it's that we are living in a time when information is readily accessible and you can go anywhere, do your own research to make your own assessments about what's happening. So the first thing you can do, as I said, is determine if the source of the information that you're sharing is credible. Do a simple Google search of the person's name. Is this physician an actual board certified physician? Is this physician practicing in the setting with which he is talking about? So if he's discussing the critical care of COVID patients, he should be a critical care doctor. Does that not make sense? Okay, it should not be a chiropractor. Not dogging chiropractors. They have a valid place in our world. It's not in the treatment of COVID. It's also not in the interpretation of the research regarding COVID because they're not actually doing the therapy, right? So they're not seeing what the effects are. They also aren't seeing the myriad complications that come along with COVID. They're just looking at this one problem. So make sure that the person is practicing within the field with which they're sharing their information. It should be an ICU doctor. It should be a hospitalist, aka a physician who cares for admitted patients in the hospital, treats the whole body and all of the complications that come with it, and not just a specialty or one organ system. One of the key things that I think many people don't understand about coronavirus is that it affects the entire body, not just the lungs. So you have to look at all the things. Okay, so make sure the source is credible. Do a Google search. Credible sources that I love: Infectious Diseases Society of America has a very user-friendly website. Tons and tons of articles. They have links to all of the clinical trials. They have professionals who interpret the results of the clinical trials for you that are believable and credible. They have a podcast, and I think they do weekly posts on this podcast about different methods of treatment and the benefits and risks associated with those. If you're looking for critical care related information, I really love a website with a podcast called EMCRIT, EMCRIT, stands for Emergency Medicine Critical Care. because this is run by a physician by the name of Scott Weingart, who practices in both of those settings. He has a lot of colleagues that come on his show and talk about the things that they're seeing related to COVID, and I really like them. Those are two sources that I listen to a lot, and they're very credible and believable. The other way that you can propagate the spread of good information is to do your own research. Now, this gets a little bit tricky, okay? It's hard for me. I took a semester of research, and it's hard for me. Physicians went to school for a gazillion years to learn how to conduct and interpret research, but that's where we go in medicine to make decisions about therapies or treatments. You have to use evidence, and we determine if something is evidence-based on clinical trials, right? You can't just come out into the world and say, I'm a physician, I practice in Texas, and I have given inhaled budesonide to 100 of my patients, and I've discovered a silver bullet that's going to cure COVID. Y'all, that's not evidence. How do you know that those 100 people wouldn't have just gotten better on their own? I mean, I think you all know that the vast majority of people who get COVID get better on their own. They don't require hospitalization. They don't require intubation. They don't die. So how do we not know that those 100 people would have just gotten better on their own? We don't. You don't know that until you conduct a clinical trial. And there are a gazillion factors that go into this, y'all. There have to be a large number of people. It has to be a multi-center study, meaning multiple hospitals have to participate in it. The person who's conducting the study has to be blinded to the control and the treatment arm and who the patients are in that. I mean, there's just a ton of factors, y'all, and I don't want this to get too heavy, so I'm not going to go into a heck of a lot of that. Just know that if it's not evidence obtained through clinical trials, it's not evidence. It's anecdotal observations. And while it may be promising and while it may offer some benefit, it requires a study in order to say that with any legitimacy that yes, this is helping people. Okay? So don't believe people when they come out and tell you something that they've done in their practice and therefore it's making people better. You have to follow the evidence. Also, if anyone comes out here and says they've come up with a magic cure, a silver bullet, that sounds too good to be true, right? Right? It probably is. So if you're going to share that, go do some research before you share it. I'm not saying that inhaled budesonide does not show some promise. It does. It requires studies. You cannot just go out there and prescribe Pulmicort for everybody and say that they're going to be cured of COVID, because there are complications to that, y'all. If you give Pulmicort, this is an inhaled steroid, guess what? Everybody's going to have thrush. So a steroid suppresses your immune system, right? It stops the immune system from doing what it needs to do, because a large part of what's happening with COVID is that there's overreaction of the immune system. Well, sometimes you want to suppress the immune system and sometimes you don't. The immune system needs to do what it needs to do to keep normal flora there. So when we're giving people steroids, when we're giving people monoclonal antibodies or other things that suppress the immune system, guess what's going to happen? Other bacteria, other funguses are going to grow. And is that going to be worse than the COVID itself? Sometimes it is. So this requires a lot of clinical judgment. It's not a one-size-fit-all answer. This is how we make these complicated decisions in healthcare. And that's why you can't just because someone comes out on public and supports a narrative that you desperately want to believe does not make it true, friends. I know that is harsh reality, but that is a reality. So do some research, do your own research, find a credible source. Don't just share things because you like what they're saying, myself included. But I am upfront and honest with you and telling you that these are my opinions, and you can choose to believe them or you can choose not to believe them. But I can assure you that my intent is good. My purpose is to educate and share information with the public, because I know you all desperately want to know this information. So that's all I have for you today. Drop a note and let me know what it is you want to know about, and I will put it on the agenda. I've got lots of thoughts on things that I want to share, because I always have lots of opinions. But if there's something in particular that you're interested in, let me know. And thanks for listening, guys. Be safe out there, okay?